Number 1. Monica Seles, stabbing incident and career disruption. In April 1993, Monica Seles, then the world number 1, was stabbed in the back by a spectator during a quarterfinal match in Hamburg, Germany. The attack caused a deep wound between her shoulder blades, physically injuring her and causing significant psychological trauma. Seles was forced to take a 2-year break from the sport. During her absence, her ranking dropped, and she lost her momentum as the most dominant female player of the early 1990s. Although she returned to tennis in 1995 and won several titles, she never regained her former dominance or won another Grand Slam outside of her comeback victory at the 1996 Australian Open. The attack fundamentally altered her career trajectory, and her playing style became more cautious as a result of ongoing anxiety and post-traumatic stress. Number 2. Rafael Nadal, chronic knee tendinitis. Rafael Nadal's career has been repeatedly affected by chronic tendinitis in both knees, particularly the patellar tendon. The condition first surfaced in 2009, causing him to withdraw from Wimbledon that year and leading to extended breaks from the tour. Tendinitis is the inflammation or irritation of a tendon, often caused by repetitive motion or overuse, both common in professional tennis. For Nadal, the injury resulted in persistent pain, forced absences, and frequent changes to his tournament schedule. He underwent multiple treatments, including platelet-rich plasma therapy, physical therapy, and rest. The chronic nature of tendinitis has shaped Nadal's career, requiring constant adaptation in his training and match load. Yet he managed to return and win multiple Grand Slam titles despite the limitations. Number 3. Juan Martín del Potro, repeated wrist injuries. Juan Martín del Potro, the 2009 US Open champion, saw his career trajectory sharply altered by a series of wrist injuries. In 2010, Del Potro suffered a right wrist injury that required surgery, keeping him off the tour for nearly a year. After returning, he adapted his two-handed backhand to reduce stress on the wrist. Later in 2014, he developed an issue in his left wrist, again leading to surgery and extended absences. Repeated surgeries and long rehabilitation periods interrupted his momentum, caused fluctuations in his world ranking, and forced him to modify his playing style. Despite making multiple comebacks, including a silver medal at the 2016 Olympics and a 2018 US Open final, his career has been characterized by intermittent success and lengthy injury layoffs. Number 4. Andy Murray, hip injury and surgeries. Andy Murray, a former world number 1 and 3-time Grand Slam champion, suffered a chronic right hip injury beginning in 2017. The hip pain stemmed from a degenerative condition known as femoroacetabular impingement, where abnormal contact between the hip bones leads to cartilage damage. The injury limited Murray's movement and forced him to end his 2017 season prematurely. He underwent hip surgery in January 2018, but the pain persisted, requiring a second, more invasive hip resurfacing operation in January 2019. Hip resurfacing involves capping the femoral head with a smooth metal covering to reduce pain and restore mobility. While the procedure allowed Murray to return to the ATP Tour and win a singles title in 2019, he has not returned to his previous elite level, and his schedule remains limited due to the ongoing effects of the injury. Number 5. Serena Williams, foot injury and pulmonary embolism. In July 2010, Serena Williams suffered a severe cut to her right foot after stepping on broken glass at a restaurant in Munich. The injury required 2 surgeries to repair lacerated tendons and forced her off the tour for nearly a year. While recovering, Williams developed blood clots in her lungs, a condition known as a pulmonary embolism. This potentially life-threatening complication required immediate medical intervention and further delayed her return. Upon her eventual comeback in 2011, Williams gradually regained her fitness and competitive form. But the episode underscored the unpredictability and seriousness of injuries in professional tennis. Despite these setbacks, she went on to win multiple Grand Slam titles, demonstrating remarkable resilience. But the injuries and health scares contributed to a more selective tournament schedule for the remainder of her career. Number 6. Novak Djokovic, elbow injury and surgery. In early 2017, Novak Djokovic began experiencing pain and loss of function in his right elbow, later diagnosed as a chronic injury from overuse. The elbow is a critical joint for serving and ground strokes, and Djokovic's condition forced him to withdraw from several tournaments and ultimately end his 2017 season early. After unsuccessful conservative treatments, Djokovic underwent a minor surgical procedure in early 2018 to address the issue. The rehabilitation process required changes to his service motion and training methods. Djokovic struggled with form and confidence for several months after returning, but gradually regained his top level, winning Wimbledon in July 2018. The elbow injury marked a period of vulnerability and transformation in Djokovic's career, requiring both physical and mental adaptation. Number 7. Martina Hingis, chronic ankle injuries. Martina Hingis, the Swiss tennis prodigy and 5-time Grand Slam singles champion, suffered repeated ligament injuries and chronic inflammation in both ankles. The ankle is vital for quick changes in direction and stability on the court. In 2002, persistent pain and multiple surgeries forced Hingis to announce her first retirement at age 22. She cited her inability to play pain-free and compete at the highest level. Although Hingis made successful doubles comebacks years later, her singles career never fully recovered, and the chronic nature of her injuries effectively cut short one of the most promising careers in women's tennis history. Number 8. Stan Wawrinka, knee surgery and recovery. In August 2017, Stan Wawrinka, a 3-time Grand Slam champion, underwent surgery on his left knee to repair cartilage damage. The knee is critical for movement and absorbing the impact of running and sliding on different court surfaces. Wawrinka's post-surgery rehabilitation was lengthy and involved regaining muscle strength, balance, and mobility. He missed the remainder of the 2017 season and struggled with form and confidence upon his return in 2018. While Wawrinka managed to compete at a high level in subsequent years, including several deep Grand Slam runs, he has not consistently returned to his championship-winning best, and his schedule is often limited by ongoing knee management. Number 9. Kei Nishikori, chronic wrist and elbow injuries. Kei Nishikori's career has been repeatedly hampered by injuries to his wrists and elbows, common among players with powerful two-handed backhands and high-intensity playing styles. His most notable injury came in 2017 when a right wrist tendon tear forced him to end his season early and undergo extensive rehabilitation. The repetitive nature of tennis strokes often leads to micro-tears and inflammation in these joints. Nishikori's ongoing battles with injury have led to frequent withdrawals from tournaments, limited off-season preparation, and several comebacks at less than full strength. These physical limitations have prevented him from consistently challenging for major titles, despite his technical skill and speed. Number 10. Venus Williams, Sjogren's syndrome and fatigue. In 2011, Venus Williams was diagnosed with Sjogren's syndrome, an autoimmune disorder that causes extreme fatigue, joint pain, and dry eyes and mouth. This condition is not an acute injury, but a chronic illness that severely impacts athletic performance. The diagnosis followed years of unexplained drops in form and recurring injuries. The effects of Sjogren's forced Venus to withdraw from the 2011 US Open and reduce her playing schedule. Treatment included medications, lifestyle changes, and careful management of her workload. While she managed to return to competitive tennis and reach Grand Slam finals, her ability to play long seasons and recover between matches was permanently affected, leading to a focus on doubles and a selective singles schedule. Number 11. Marin Cilic, knee injury and meniscus surgery. Marin Cilic, the 2014 US Open champion, suffered a knee injury in 2022 that resulted in a torn meniscus, a cartilage disc that cushions the knee joint. The injury occurred during a practice session and required arthroscopic surgery to repair the damage. The meniscus is crucial for absorbing shock and stabilizing the knee during movement. Cilic missed much of the 2023 season, and his return to competition was marked by caution and a reduced tournament schedule. Extended time away from the tour caused a drop in ranking and a struggle to regain previous form, highlighting how even one injury can dramatically disrupt a player's career path. Number 12. Grigor Dimitrov, shoulder and groin injuries. Grigor Dimitrov, known for his athleticism and all-court game, has been hampered at various points by shoulder and groin injuries. Shoulder injuries in tennis are often related to the repetitive overhead motion of serving and can include rotator cuff tears or inflammation. Groin injuries affect explosive movement and directional changes. Dimitrov missed several major tournaments between 2018 and 2022 due to these injuries, impacting his ranking and consistency. The recurring nature of these problems led to cautious scheduling, ongoing rehabilitation, and adaptation of training routines to avoid re-injury. Number 13. Petra Kvitova, hand injury from home invasion. In December 2016, Petra Kvitova, a 2-time Wimbledon champion, was attacked during a home invasion in her Czech Republic apartment. She suffered deep lacerations to the tendons and nerves in her left hand, her playing hand, while defending herself from the intruder. Surgeons performed hours of reconstructive surgery, followed by months of physical therapy to restore function and strength. Kvitova returned to professional tennis 5 months later, an unusually rapid recovery, but her hand never fully regained its original strength and flexibility. The injury changed her grip and forced ongoing adaptations in her play. Number 14. David Goffin, eye injury at the French Open. During the 2017 French Open, David Goffin suffered a painful right ankle injury after slipping on the court, which already posed a setback to his season. However, a more severe and unusual incident occurred the following year in 2018, dramatically impacting his career trajectory. In a match, a tennis ball unexpectedly deflected off Goffin's own racket and struck his left eye with significant force. This freak accident led to a serious eye injury, temporarily impairing his vision and disrupting his depth perception, two abilities essential for elite tennis players. Eye injuries are uncommon in tennis but can have long-term consequences. Goffin was forced to take several weeks off for medical treatment and recovery. When he returned, he faced ongoing challenges. His timing, hand-eye coordination, and overall confidence were affected. Persistent vision issues hampered his consistency and performance on court, making this eye injury a defining moment in his professional journey.